Hi, welcome to Pilates by Georgette.com. This is an Improve Your Lungs Pilates class. I've been specifically asked to do this class by fellow PBG members who have been suffering with long COVID, tight chests and shortness of breath. These are common complaints following having COVID or following a chest infection or viral infection of your lungs. It's really important that we work with our bodies to try and improve the quality of every breath that we take. If you're struggling with shortness of breath a few weeks on after suffering with COVID, then I do suggest you try and do this class every day for the next few weeks to try and improve the quality of every breath that you take. Now, if we're thinking about our breathing, there's lots of functions that we need to think about on how they're working. We have our rib cage, that's the bony structure of the ribs and the spine at the back and the breastbone at the front, creating a housing system for our beautiful lungs to live in. We've got our breathing muscle at the bottom and the base. That's our diaphragm. If we put our hands to the base of our ribs and take a deep breath in, we'll feel our ribs expand, and that's where our diaphragm's working to pull itself out, allowing space in the thorax here to open, pulling the air in to expand into the base of our lungs. We've got lots of accessory muscles as well that work in between the ribs, across the top and the shoulders, and they work to also help to lift. What we tend to see when people become short of breath is that they start to overwork with these accessory muscles and they stop working with the big muscles at the base. Now, if we're looking at the way that anatomically your ribs and your lungs are formed, at the bottom of your ribs, down here and towards the back predominantly, that's where the majority of the little air sacs in your lungs, your alveoli, are situated. And that is where you have the maximal ability to take air in and to transfer oxygen off that air back onto your bloodstream. So you really do always want to think about breathing deep and wide. Now, after having a viral infection myself, only a few weeks ago, you'll have to excuse me if I am doing some coughing within this class, because I'm certainly finding that doing this active cycle of breathing technique is helping me hugely. But I've put that into combination with Pilates and some gentle stretches, because I found that by moving, stretching and opening my whole chest and spine has improved my ribs and my lung function hugely. So let's start with some gentle movement and mobility, and then we'll progress onto the active cycle of breathing. Okay, so I'm going to work in kneeling, but you could do all of these exercises on a chair or in standing if you prefer. We're going to start by just taking our head and neck and just gently releasing it down to one side, centering back and releasing to the other side, and centering back. Draw your chin in and let your head fold down. Roll your head back up and pause. Draw your chin down and the other way, center it up. Down you go to the front and up you come to the center. Now just allow your head to gently roll around to the front, stretching those neck muscles, and roll around in the other direction. Bring yourself to the middle. Lift up with your shoulders and drop back, allowing yourself just to gently move at this point in your body. Good. Perfect. Now let's try that with a breath. So I want you to take a deep breath in, let your ribs lift up, and relax out. Inhale up and out. Now try to breathe that movement through your nose coming in and your mouth coming out. In through your nose and out through your mouth. In through your nose and out through your mouth. Perfect. Take your hand down on one side, take a big stretch over there and back to your center. Take your hand down to the other side and take a big stretch over there and back to the center. Now I want you to use some visualization. Taking your hand down to one side, reach the arm over, and this time pausing in this position to think about breathing deep and wide into the top of those ribs. Inhale, breath. Exhale, breath. Now, if you're starting to move well, start to think about expanding further. So taking that deep breath in and trying to hold that deep breath in. Pause before you breathe out. And breathe out slowly, giving yourself the maximal amount of time to get all the oxygen you can out of that blood breath. Inhale over the other way. And the same thing here. Take a deep breath into the top of the ribs. And visualize lifting those ribs up and them expanding out. And release it back. Great. I'm going to turn onto my side so you can see me working here. As we said, a lot of the air is up in the back. So I want you to think about reaching your arms forward and pushing your bottom back and down So you're into this puppy pose, and I want you to breathe and visualize the breath coming in through your nose and expanding out into the base of the lower back. Breathe deep and wide there. Exhale to release and continue deep and wide into the base of the lungs. And exhale to release. Think about, as you're doing this, how you're creating these positions of postural drainage, allowing your body to drain out any sputum or gunk that you have in your lungs and bring it more towards the center of your breathing tree so that you're able to expel it easier. It also allows you to breathe into different parts of your lungs. So you improve the function of your lungs by really making sure that all the little air sacs in your lungs are having breath pushed into them and staying open. Brilliant. Push back into your heels again. Now taking your hands, just twist on your upper body. In this twisted position, take a deep breath. Exhale slowly. Turn the other way. Take a deep breath. And exhale slowly. Taking your hands behind your head, I'm going to get you now to think about rounding out through your back, making an arched spine, and then inhaling and lifting up through your chest, pulling up through the front of the ribs. All of these exercises just improving the position and mobility of your body to move, and therefore your ability of your rib cage to dynamically move as you're breathing. Inhale, we lift. Exhale, we release. Inhale, we lift. Exhale, we release. One more. Inhale, we lift. And exhale, we release. Perfect. And relax. Okay, so we've mobilized out our spine. Now I want to think about the active cycle of breathing technique that we use as physiotherapists in hospital to help people and encourage people to clear their chest and improve their lung function. We start with breathing control. So I'm going to get you to stay upright. Don't do this in lying. Lying is going to put you're going to make and change the way that you're breathing entirely, because when we lie down, we only tend to breathe the top part of our lungs. And as we said at the start, the best place to be breathing is down into the base and back of our lungs. So by being upright, we maximize that ability to ventilate. So take your hands to your rib cage. And the reason I want you to do that is because I want you to feel how your ribs are moving. We're going to start with gentle breathing control. So I'd like you to try and breathe in through your nose and out through your nose. Slowly, take your time. If you can't, because you're quite congested there because of COVID, then do mouth breathe if you need to. You can always try and go in through your nose and out through your mouth, but if able, try to go through the nose only. Relax with every breath that you take. As you exhale, slowly relax those shoulders. Relax your mind. And try to draw your awareness to the rise and fall of your hands on your rib cage. As you inhale, the hands rise out. That diaphragm lowers, we expand the thorax. And exhale, we release. Inhale. And exhale. One more, inhale. And exhale. Well done. I'd now like you to try deep breathing. So take your hands to the wide part of your ribs, again to facilitate where we're working. I want you to take that air in through your nose, feel it come in and take it all the way down into the base of those lungs. Feel those ribs lift, widen and expand. Are we ready? Inhale, breath. Hold it in. Exhale slowly through your nose if you can. If you struggle with that, try and pierce your lips like you were trying to blow on a flute as you're breathing out. Again, think about breathing out slowly. Inhale, breath, deep and wide. Breathe down into the base of the lungs. Piercing your lips allows you to create a resistance in those breathing sacs, which helps to keep them open that little bit longer. Inhale, breath, deep and wide. Exhale slowly. Well done. Finally, the magic huff, as we call it in the physio world. This is where you're going to create a forced expelling of the air, which is going to move any debris in your lungs or any phlegm or congestion that you have and help to clear out, particularly the base of the lungs where it's difficult to cough. Coughing itself is quite ineffective. only tends to move the stuff at the very top of your breathing tree, up here in your bronchus. So if we want to get down into those little breathing sacs, those alveoli, we've got to shift the fluid into the center and then up and out. So we use the huff to create that. We have a short huff, and that's going to move fluid from the base. And then we have a longer huff, and that's going to move things from the center and up. Okay, so we're going to try and learn how to huff effectively, and this will make your coughing so much more effective. Coughing itself kind of pushes everything out and wide because it's a violent movement. Huffing brings everything up, and then a cough should expel it. So I want you to make an O shape with your mouth. And I want you to imagine that you have a mirror placed in front of you, and you're going to try and steam that mirror up. And you breathe out. Try again. Well done. If you want to use a mirror to actually see if you can steam up, then that's a really good idea if you're struggling with the visualization. Quite often, if you do a few coughs and you've had COVID like me recently, that will make you want to cough. So excuse me. That's an effective huff, which has led to an effective cough. Okay, when you cough stuff up, try to spit it out, try to get rid of it and expel it. Try not, if you can, to swallow it. We're going to try and put all of these movements together. So we've got the short huff, the long huff, the breathing control, and the deep breaths. Shall we try and put them together as a little bit of a cycle, and then you can take that away and work with it. There's no set number of cycles you need to do. We used to always say in the hospital, try and work till you have an effective cough, but COVID can be quite dry, and actually just doing the cycle of breath just encourages your maximal ventilation and encourages and improves the way that you're breathing. So you may not actually be able to cough anything up, and don't worry, that doesn't mean you're not doing it right. Just try and think about that breathing control and deep breath and a few huffs to clear out the lungs if it's there. So we'll start with breathing control. Take 3 lovely slow breaths in and out. In and out. In and out. And 2 big deep breaths down into the base of the lungs. Hold that breath in, hold that breath in. If you think you could have more breaths, then sniff. And then breathe out slowly. Sniff helps to hyperextend those lungs. So try again. Deep breath in, widen through the ribs. Hold and sniff. And release. Perfect. And now let's try 2 short huffs and 2 long huffs. Create a circle with your mouth. Force that breath out, steam up that window. 2 short ones. 2 long ones. And if you needed to, you could cough, and you would repeat that cycle maybe 3 times. I do hope you have found this video effective, and that you like and follow the Pilates by Georgia Instagram and Facebook pages. For more free videos, take the best care. Bye-bye.